Stafford Hospital is a COEMIG Center, and the importance of it being a COEMIG Center is it offers minimally invasive surgery to women. So knowing that you have a surgeon that will provide such care in this hospital is very important, because most of the time some women feel like they have to travel far to achieve the surgical management.
One of the greatest advantages of being a COEMIG center is that even though we're a small hospital in a regional community, in a small community, we have the opportunity to give world-class medicine to our patients and offer patients world-class surgery. One of the beauties of gynecologic surgery is that the vast majority of procedures can and should be done in a minimally invasive fashion. Laparoscopic surgery really gives you the opportunity to fully examine the entire abdomen and the pelvis, see all the organs and the structures really clearly. The biggest benefits of any type of laparoscopic or minimally invasive surgery is that the incisions that you make to enter into the body are small incisions. What we've seen so far in the last several years, we've been 100% minimally invasive for any of our procedures.
The benefits of minimally invasive surgery offers the woman a way to surgically correct the ailment that she's concerned about, but it gives them a way to do the surgery effectively in a short period of time, faster healing time.
70% of our patients go home the same day, less blood loss, less risk for infection, faster recovery, meaning they go back to their normal lives, they go back to their jobs, all within a reasonable amount of time. As compared to years ago, they may be looking at either multiple weeks of recovery or multiple months of recovery, depending on the procedure that they had.
It impacted absolutely everything, because you can't plan a trip, because you don't know when your cycle is going to hit or how hard it's going to hit. For me, in my case, the first 3 days of any cycle were horrendous. I couldn't leave the house. Fast forward 4 years and 4 gynecologists later, all specialty, I come across Dr. Thott. Given my age, I was 41 at the time, a partial hysterectomy was the way to go. Once in surgery, that's where he found the endometriosis, stage 4. So a procedure that lasted, or should have lasted, about an hour, give or take, lasted about 4 to 4.5 to 5 hours.
All the patients that are designated and earmarked as a COEMIG patient, they're going into a database. We call that the BOLD database. And what we're able to do then is actually go back retrospectively 1 year, 2 years, 3 years, and see, well, how did we do? Did we really have low readmission rates? Did we really have low infection rates? Did we really have no comorbidities occur during those times? And then we can actually go back and say, yeah, that's great. We actually did achieve our goals.
Once you recover, it's just a matter of getting back into the swing of things and just enjoying life. And so now it's just a matter of like, what do you want to do tonight, or what do you want to do this weekend? And it's Friday at 5 p.m. So it's a game changer. It's a game changer.
One of the biggest things that women need to know at this point is they do have this option of minimally invasive surgery. By having a woman educated about minimally invasive surgery and how much it improves the quality of life is very important, and that's why I keep on striving to be a better surgeon.
When we're able to take care of that patient and they're satisfied and they're doing well, and I see them at their 2-week or 6-week follow-up and they're like, yeah, I was like, any issues, any problems? And they're like, yeah, no worries, no problems, I'm doing great, and thanks. And their appreciation and their gratitude is pretty reward enough for me, and I'm really glad when that happens. And I think that really drives our mission. We want to make sure that we're doing the right thing by our patients.